I'm Dr. Franc Taljard. I'm a consultant anaesthetist at the University Hospital Monklands, based in Airdrie in Scotland. I am a clinician who is employed as a consultant with an interest in perioperative medicine, and I do clinics in perioperative medicine in NHS Lanarkshire. I also have an interest in the digital possibilities and the application of technology to improve the delivery of good quality healthcare and provide better outcomes. I think one of the things that I realized fairly early on in my career as well is that what actually happens on the ground is very different from what people think happen on the ground and the impression we have on how the system works. The system has actually worked through a lot of, how can I say, adaptive behavior of various people and systems where people are going above and beyond to make the system work. If you looked at the system in isolation and try to do the flow or the pathway, you will quickly find out that if this pathway did not have the people in it that facilitated it, the whole thing would fall down at a moment's notice. It could not be sustained. And that is one of the problems we have with healthcare at the moment, is we cannot rely on individual staff members to keep the system going. We need to build a more intelligent system that does not rely on human intervention necessarily to keep the system going. Yes, by all means, human intervention for those special cases that need unusual adaptations. But in terms of the actual process, we need to build it out. We need to find out what is the actual process instead of what people believe the process to be, and then build a smart system that can support working better, working faster, i.e. working smarter, not harder. I think it'd be very, very difficult. As we know from experience, it's very fragmented. Paper systems, yes, you're quite right. Some places literally have it as paper systems, a book with names stuck in it and little notes written next to it. Or some places are utilizing spreadsheets with patient names and trying to keep track of them that way. It's not interactive. It doesn't update automatically. And it's very, very error prone and dependent on a staff member keeping the system up and running and updating it continuously, which is one of the biggest problems, especially because this tends to be the task of one particular individual. And when that individual goes off sick or for some other reason leaves, then it's then left to other people who are not au fait with how their system for keeping track of the flow of patients actually worked, and the whole thing just comes clattering down around everyone's ears. But especially if we're going to push for an enhanced patient flow rate through the system, we need to do things better. If you look at Buddy Healthcare and the application of the platform that they've put together, it's very good specifically for that reason. And that is one of the things we preeminently sought when we looked at solutions, because it's very easy to get solutions that'll just take a question set that people can answer, and then you have different communication solutions that are standalone and various other standalone products which could all put together form an ecosystem to support patient flow. But luckily the Buddy Healthcare team had already built a platform to incorporate flow. So whilst it was not necessarily mentioned as such, it is basically the epitome of what we were looking for, where you have a patient who is onboarded onto the system. You can help them and track them throughout the whole system progress and even beyond in order to facilitate best care and to ensure that they're fully informed and fully motivated all through the process, with the ability to interrupt the process at any stage and ask questions. It also gives you the ability to see who else is in the pathway and thereby optimize the flow for the rest of the service. And as you say, flow is the big thing at the moment, and I think it's just flow was always important, but we're only just realizing how important it is, and that we've always been very focused on individual elements, the admission, the actual day of surgery, the date of discharge, and then post-operative follow-up, but we haven't actually put it all together in terms of pre-optimization, following the patient all the way through the system until they're discharged home and recovering from their surgery. Absolutely, and I think, the healthcare system has traditionally been very rigid in its approach, certainly in the UK and elsewhere, to be fair. In the sense that although they have tried to be patient-centered, the actual system is system-centered. It is not patient-centered as such. The patients just happen to have needed to fit into the system the way it was. With this approach, we're trying to bring in the rest of the elements that make up everybody's busy lives, i.e. their other social commitments, their financial commitments, their work commitments, and try and bring all those together in order to identify what would be the best way forward for patients. And for some patients will not be able to fit in things at short notice due to all these other commitments, but then it'd be ideal to identify those patients who can and are free at a drop of a hat, especially if we want to maintain the throughput in the system, because these patients could then readily fill the gaps if another patient at short notice cannot make it to the surgery. You've just nailed one of the big problems in terms of communication. So traditionally there's different communications that happen in the delivery of healthcare. So obviously there's communication between members of the team, there's communication between members of our team and members of other teams where they refer things to. But crucially, as the patient is the person that we are supposed to center and care about, we have no direct communication with the patient as such. If a patient tried to phone the hospital or tried to phone the team, frequently they flounder through several layers of bureaucracy before they can actually find somebody who can actually help them. And as you've alluded to, paper letters, there was a lot of resistance always in healthcare about changing from paper letters because they're perceived to be personalized and secure. So there's various reasons why we need to move forward with direct digital communications, both to enable the patient to take better onus of their own care and also for the service to become much more responsive and able to flex and accommodate short-term or short notice changes, as it may be. If you are going to start a regular system to update patients via telephone or even via letter, that's just an additional workload for the staff who are already under a lot of pressure to deliver healthcare. And in some ways, you can say that it's an unnecessary distraction from whatever else they should be doing. If we can automate things or make it easier for patients to get in touch and for us to get in touch with them to ask if there's been any change in their circumstance or just to get updated as to where they are in the process or where they think they are in the process and meet some expectations or even manage expectations of patients with regards to delivery of healthcare. It is absolutely imperative that we move to a direct communication model. I think what you need to remember is that when you look at the traditional teaching on clinical examination, you will find that most people will say to you that the history you take from a patient is far more important than actually necessarily laying hands on the patient or clinically examining them. Clinical examination helps to confirm the diagnosis, but quite often the diagnosis is already suggested by the history from the patient. Patients will also know that their circumstances or their abilities have changed, and therefore will be able to tell you that. I can see no reason why you cannot do that kind of assessment on a digital platform. Of course, sometimes you will need to bring the patient in to actually do a physical examination and maybe do some additional tests to clarify and make sure that you've got things right. But absolutely, it is possible and it should be done.